George Yu has over 15 years of experience in venture startups, investment banking, and management consulting. He was previously a managing partner at Bay to Peak SA, a boutique investment and advisory firm where he assisted small healthcare companies in company formation, capital raising, business planning, strategic partnering, and going public transactions. Mr. Yu?
Hi, my name is George Yu. I'm the CEO of CytoWave Technologies. So we're a company that's developing a diagnostic device for detection of metastatic cancer cells. And the first indication we're targeting is the melanoma, actually. Let me go to the first slide. So we licensed the technology. It's a laser-based technology where you point the laser to a hand vein vessel, and then every time a cancer cell passes by that laser within that hand vein vessel, it absorbs the laser energy and then emits an acoustic wave that you can detect with an ultrasound transducer. So it is a device for the early stage detection that is non-invasive in vivo. So what you can see here on the picture is a more experimental setup. I'll show you the current prototype a little bit later. But you'll see that the volunteer here pushes his hand into the device, and the laser is actually in that black box, and the laser gets directed to the hand vein vessel, and then you can have a printout or readout on the computer monitor. And the technology itself has been developed with about $4.5 million in public funding, primarily from the National Institutes of Health and National Cancer Institute. So a lot of the early stage development risk has already been alleviated. And when we came in and licensed the technology, it was basically ready to go into human trial, which was very attractive for us. So all their preclinical animal studies have been completed at that point. Let me talk a little bit about the technology itself. You'll see a schematic there. You see the blood vessel within those two blue bars. So you see the red blood cells and then the melanoma cells, and then you see the laser beam basically cutting through the blood vessel like a curtain. So every time you have melanoma passing through, it characteristically absorbs the laser energy, emits an acoustic wave, and then with the ultrasound transducer that you can also see on the right-hand side, you basically detect it, and you can count every single cell. And you have a characteristic detection based on the wavelength, primarily the wavelength, and also the laser energy that you apply to it. So here you can see the actual prototype as it is right now on the upper left corner. It's a box, probably the size of 2 printers. You can move it around. You can roll it in the hospital. The laser itself is beneath the box, and you'll see how the patient puts her right hand into that device. It's non-invasive. There's no blood samples. There's no pain. And the patient leaves it there for about 30 to 40 minutes. And you can basically examine the entire blood volume of 5 liters in a human adult. That's what we call a liquid biopsy. You can compare it to biopsy with a primary tumor, where you really take a sample. In this case, you examine the entire blood volume without ever taking any blood. And then on the bottom, you see the readout in the prototype. This is actually a healthy volunteer, so you don't see any spikes there. We just started the first patient trial 2 days ago. We had the first patient actually tested. It was successful. But what you can see here is you have a fairly homogeneous band of signals that's primarily coming from red blood cells that's prevalent in the human volunteer. If he had melanoma cells in his blood, you will see that spike, a very characteristic spike that would probably be like 5 to 7 times the amplitude that you can see here with the red blood cell. And this is where you really cut it off. You can determine at what standard deviation would you cut it off and say this is a signal from a melanoma cell. So let me talk a little bit about the market. So what's approved right now is an in vitro assay by Johnson & Johnson. Their assay is called Cell Surge. The issue with basically there's only one assay right now. It's an in vitro assay. The issue with in vitro methodologies is that you are limited by the blood sample size. So you only take a few milliliters of blood. If you take 1 liter, by definition, a milliliter, by definition, you cannot detect less than 1 cell per milliliter. If you project it to the 5 liters of volume that you have in your body, at that point you actually have 5,000 cells in your body. Now 5,000 cells is actually a lot in terms of metastatic cells in your body, and oftentimes if you detect it at that point, it's often too late to intervene or guide your treatment. With our technology, because we examined the entire 5 liters, if we can detect 50 cells in 5 liters, which is fairly achievable, you actually have a 100-fold improvement in sensitivity, 50 versus 5,000. And this is where this is where our advantage of the technology comes into play, and this is where we believe that with the in vivo technology, we will be superior to any in vitro assay that's on the market right now. Having that said, J&J has done a pretty good job in terms of creating that market, preparing that market. They've gone out and marketed to physicians, and J&J's device right now is actually covered by Medicare for CTC testing and by most commercial plans. So the payers have already accepted the testing of a metastatic cancer cell as a proven method in the treatment of metastatic cancer. So what's the commercial opportunity here? We believe that this device, since it's fairly mobile, portable, it could be widely used by a number of oncologists and dermatologists that treat melanoma patients. We think that there's an advantage compared to in vitro assays because it's a real-time readout. You saw it in the picture. It's fairly comfortable for a patient. The patient can sit or lie down. It takes half an hour. You have an immediate real-time readout of how many cancer cells that patient has, versus any in vitro assay where you need about at least a day and you have to work with pathologists to do the readout. So it's a lot more cumbersome, whereas our methodology it's not only more sensitive, it's also very easy to use. You don't need to train. You don't need to have a highly trained staff to use that device. You can compare it to almost to an ultrasound machine. That's fairly easy to use. So in terms of the clinical trial that we basically started 2 days ago, our goal is to start with 10 patients as a feasibility study, and also it will help us to optimize our device itself. And then after we have the data readout from 10 patients, which we expect probably by the end of August, we will go into a larger clinical trial with 60 patients. There's going to be 2 cohorts essentially. The first cohort are late-stage melanoma patients where we would validate our technology and compare to any in vitro assays. And then the second cohort would be another 30 patients where we would demonstrate that our device can detect CTCs below the detection limits of in vitro assays, because we're looking at early-stage melanoma patients where they have concentration of metastatic cells that are still below the detection limits. And we expect the readout of that trial probably first quarter of next year. So given the timeline, let me just go next slide. Given the timeline, until the end of this year, we'll optimize the prototype, we do the 10-patient trial, and then go into the 60-patient larger trial. And then in the middle of next year, we would, with that data in hand, we would target a strategic partnership because it will take significant resources to continue the development of the device. At that point, we would expect a multi-center 200 to 300 patient clinical trial, as J&J actually was required by the FDA for its device. And we also have patents to other applications of this technology. It's really a platform with multiple applications. We can develop it for detection of cells in the lymphatic system. Today, there's really no good methodology to find cells in the lymphatic system. We can also develop it for blood clot detection, since we have patents there as well. And given that corporate development timeline, on the capital market side, We're actually a public company now. We filed a Form 10, and it was effective 2 months ago, and it was cleared by the SEC last week, essentially. We applied for a trading symbol. We expect to get approved by FINRA, receive a symbol probably at the end of next month. And then as we develop the cancer trial with 60 patients and have a readout, we would also target an uplisting to a high exchange at some point, but our first exchange is going to be the OTCQB, since we're a fully reporting company now. So what we're planning in terms of funding for the next 12 months, given the resource that's required to move the clinical trials forward, our projection is more like $2 to $3 million. We're targeting a raise of about $1 million this year, and then another $1 to $2 million next year in order to complete that 60-patient trial. And what the company really has at this point is an asset that we licensed from the University of Arkansas that when we licensed it was ready to go into human trials. And probably around this time next year, we expect to have solid patient data with 60 patients where the prototype is optimized. And we would also demonstrate that we can not only detect it, detect it at a level that's comparable to any in vitro assay, but also go into detection concentration that's significantly lower than anything you can see with in vitro assays, just based on the fact that we can examine entire blood volume. Okay, I thank you for your attention.